Welcome back to Uprising. I'm Sonali Kolhatkar. You can now watch Uprising online at our YouTube channel. That's at youtube.com/uprising with Sonali. Please do subscribe. There was a time a few months ago when the biggest news on our radar was the Ebola epidemic, particularly when Ebola reached the U.S. Hysteria over the fatal contagion spread like wildfire. Since the epidemic started, it is estimated that thousands of people have died. In fact, new statistics by the World Health Organization released just this week put the exact death toll at 8,371 and the number of infected people at 21,171, and most of those in three West African countries, Liberia, Sierra Leone, and Guinea. But with the media coverage dying down, what has become of the spread of the virus? Well, there's good news and bad news. On the good news front, Sierra Leonean President Ernest Bai Koroma predicted yesterday that his nation will have no new Ebola cases by the end of March and that it would be free of the virus by May. The U.S.'s Centers for Disease Control and Prevention Director, Dr. Tom Friedman, concurred on Tuesday, saying that the virus would likely not reemerge this year, and the World Health Organization has offered a similar, albeit cautious, prediction. The bad news is that earlier WHO predictions of eliminating the virus on January 1st did not pan out. In fact, in Guinea, one of the hard-hit nations, reports have emerged of a mob in a remote village killing two men suspected of having Ebola. And Sierra Leone reported 19 new cases this week alone. My guest is Dr. Duogbeh Nyan. He is an infectious disease specialist and the director of the Secretariat of the Diaspora Liberian Emergency Response Task Force on the Ebola crisis. We've had him on the show before. Welcome back.
Thank you for having me.
Now, what do you make of the predictions by the WHO, the US CDC, and even the Sierra Leone president that we're confident of winning the war on Ebola this year? Are you also optimistic?
There is some hint of optimism because of the massive amount of support that have poured into the region. Um, the prediction earlier by the CDC that cases could reach up to 1 million if the condition was not addressed has been debunked because the condition has been addressed. And many nations have poured in a lot of resources. There have been a lot of educational campaign and infectious disease awareness going on in the triplet countries, as I would call them, Sierra Leone, Guinea, and Liberia. And enough medical personnel have been sent. A lot of aid agencies have also donated a good number of materials and medicine as well as personnel to the region. Countries such as China, and Cuba, and the United States, of course, have sent in a huge amount of support in terms of manpower. So with all of this that we have called for in the past, we've seen a reduction in the cases. This is a situation of hope, but it is not the actual solution.